Hello beautiful people, welcome back to the channel. In today's video we're going to be exploring Cotiviti. So let's talk about Cotiviti for a little bit. So this is a healthcare organization. They do offer quite a number of benefits. According to their page, they offer team members a competitive benefit package to address a wide range of personal and family needs. Our teams are located in several different countries, and some of our benefits and programs vary with those locations. Among these are cultural celebrations, religious holidays, financial plans, and services. They also offer transportation assistance and so forth. In some cases, they provide cell phones to their employees. They pay for equipment. They would provide, from reviews that I was reading online, they provide reimbursement for internet in some cases, obviously depending on the location you are, or also in some cases specifically what is included in your package that would determine what you're going to get. They also offer the referral award. So if you're already an employee and you refer employees, you can also get awarded for doing so. So that is Cotiviti, right? So we're going to dive right into the opportunities they currently have open. The first one is this one titled Content Analyst Level 2. This position is a key member of the clinical operations and content team responsible for research, quality assurance, and opportunity analysis associated with new medical policies. In addition, this position will be responsible for the review as well as analysis of current medical policies and assisting in research necessary to define logic or algorithm to expand the Cotiviti payment policy library. So this program is basically focusing on policies. You're going to be doing a lot of research to determine whether or not Cotiviti as an organization is actually paying as they should, paying compared to industry standard. You'll be writing a lot of business plans, business logic to account for any discrepancy, or in some cases any type of gaps that are identified. You're really going to become the industry SME in the area of reimbursement. You're going to also be working with a lot of clients that they offer services to, making sure that their codes are up to date, and in this case we're talking about medical codes. So with this position, you're also going to be doing a lot of quality assurance type of work, and that makes a lot of sense, right? Because you are going to be ensuring that different codes are programmed correctly in the system and they are actually showing as they should, especially from a user perspective. With this position, they're looking for someone who has 3 years of experience in internet-based type of research, someone who has experience in coding, someone who has, especially with HCPCS, CPT codes, ICD-10, NDC, and so forth, and minimum of 5 years in a clinical setting, whether you're a nurse or you're a pharmacist or a physician, minimum of 6 years, and in clinical coding, preferably in a payer type of setting. So that's what this position is. As I mentioned before, with this position, you are going to be managing a lot of medical related type of policies. So it makes sense that you're looking for people that are in those fields. Specifically, if you are a nurse, this is really an opportunity to consider. If you're also a pharmacist, this is one to consider as well. So one of the things I read about is that this position actually has an entry level role. So entry level meaning that you may not need to have any type of experience, but currently what's open is a level 2 position. So I just want to make sure that I mention that. The salary for this position is between $68,000 and $95,000 per year. Again, $68,000 to $95,000 per year, depending on where you're located. The experience you bring to the table, your certifications, your qualifications will determine where you fall within this bracket. All right, so we're going to move on to the next position that they have open at the moment, which is a data insight. This is under the reporting and analytics. That makes sense, right? You are going to be focusing a lot on reports, on data. You're going to be making sure that technology such as Tableau, Access, which is the Microsoft one, those type of database systems are very important to this job. You are going to also be talking about SQL, for example, would also come into place with this, come into play for this one. Databases, right? So those are very, very essential with this one here. They talk about architect and hands-on development of analytics as well as reporting solutions. So really this individual is going to be focusing on using data to provide resolution, kind of making sure on the back end if there are some architectural work that needs to happen, meaning putting together building that needs to happen to ensure that the front end is seamless, especially from a data and reporting perspective. They are asking for 2 years of experience in advanced analytics, 2 years of experience delivering actionable insights from data. They also talk about Python, they talk about a little bit of coding, right? We talked about SQL and so forth. So those are just some of the requirements for this position. And for this position, the salary range is slightly higher, which is $72,000 to $96,000 per year. So let's talk a little bit about some of the qualifications, right? I don't see any education qualifications on here. Primarily, they are looking for skills. They're looking for skill sets. So even if you have a bachelor's degree, I'm sure it will only be to your benefit, but primarily what they have listed here, there is really no education requirements that is being called out. They are focusing on you having the skill set to be able to perform tasks and be able to get the job done. All right, let's move on to the next role. The next one is a clinical analyst level 1 position. This is also fully remote, and this position is in the area of audits. You're going to be doing a lot of client data type of audits, making sure that from a utilization management perspective that different codes align to different procedures, making sure that these procedures are being offered to the appropriate individuals. Alignment becomes very important. Prioritization, authorization for services really is essential here as well. So really just focusing primarily codes as well as billing procedures and policies that have been put in place. They're really looking for clinical individuals for this particular position. The formal title for this role is Coding Validation Analyst Level 1 and is staffed with RNs. So they're looking for nurses. So nurses with active licenses, irrespective of state, should make sure that they are submitting application for this one, because if there's one thing that I've always seen significant interest on is nurses looking for remote position. That can be a challenge because the tendency for nurses to want to work in a clinical setting, a hospital, hands-on, is a whole lot higher, and more opportunities are out there focusing on that versus nurses that want to work from home, that want to focus on taking care of their family or doing one thing or the other and want to work remotely can be challenging. So Cotiviti is really a place for those type of individuals, for nurses to explore, especially if they are actively looking for new opportunities and also unique opportunities as well. This position really is about willingness to obtain New York independent insurance adjuster licensure. So they are looking for somebody who's willing to obtain that licensure, and they will be paying for that license. This particular position, 2 years of professional experience is what they're looking for. You've done providing direct patient care, so they want to make sure that you've done that. Training for this position is approximately 17 weeks and can be completed remotely. Time off during the training period will not be preferred. So they're looking for somebody who's going to be able to accommodate training that is going to be offered to them. So you'll be trained to do this position, paid while being trained to actually fulfill this job. So that's really, really awesome. The target start date is September, as you can see on here, and hours of training is 7 a.m. to 3 p.m. Eastern. So you see that on here. After you've been trained, then you can then go back to the typical 9 to 5 type of schedule. So that is what they're talking about here. Possesses excellent written and verbal communication skills. Talks about being able to be accurate as well as effective, as somebody that is very efficient at your job, really more concerned to producing quality work over anything else. So that's what they're talking about here. The salary range is between $29 and $35 per hour. So even though that they're talking about it being staffed by nurses, when you look at the description of this this particular role. This is a position that's actually may not be, but it looks to me that they are talking about you having an active license, RON license in your state. So the salary is a little bit on the low end for me from that perspective, but I still wanted to share it in case if there's anybody interested, especially if maybe you have LPN, and you can definitely still go ahead and submit your application. All right. So the last position that I have on my list is this one titled Auditor Level 2, and this is contract compliance. I've always been a huge fan of compliance. I love regulatory adherence type of roles, compliance roles. Those are definitely roles that I get excited about, and they are offering this position, which I thought was a good one. Basically, your focus is on just retail clients. They are retail clients. So there's a niche that you are going to be focusing on, which I always like to, because it allows you to become a SME in that area, and which gives you more relevance to the organization in general. So you're going to be utilizing retail experience to perform audit procedures that include identifying and defining issues, developing criteria, reviewing, analyzing evidence with the intent to audit standard medium, right? So they also talk about being able to effectively utilize different audit tools and so forth. So this individual really is going to be focusing on auditing, primarily a bachelor's degree in accounting, master's in accounting. If you have a legal degree, is preferred. As I mentioned, compliance is a very hot topic, so a lot of times, even if you are going to provide support, that should be okay, but most of the times, you know, legal individuals, people in law, tend to be more favored than others. But from a supportive type of role, definitely non-clinicians are people they bring around them to deal with response and so forth. So they also talk about someone who's very strong in technical skill sets such as Word, Excel, and many others, but those are just more of a preference. Excellent communication skills, someone with strong project management type of skill set, so communicating with others to exchange information. So there are quite a number of requirements that they are expecting here. This position is $65,000 to $83,000 per year is the salary. So those are the positions, guys. I hope you find these leads helpful. Give this video a thumbs up, subscribe to this channel if you've not subscribed already. Till next time, I wish you all the very best of luck, and I will catch you in the next video. Take care, guys. Bye bye.